All right, everybody, welcome to New Agent Training Part 3, Selling in the Age of Obamacare. My name is Duryea. I'm going to be your host for this part of training, and we're going to go ahead and get started. The first thing I'd like to talk about is how to educate yourself for success. Well, obviously, the first thing you're going to want to do is to complete the recorded USABG 8-part New Agent trainings. Obviously, you're well on your way to doing that. This is part 3. You'll have 5 parts remaining after this session. The next thing you're going to want to do is complete the recorded iBoomerang Web Tools trainings, which are available in the same area in your back office. Next thing, complete the exclusive USABG carrier trainings for all the required and recommended products that we have. These can be found on the training calendar in the quick links area in the back office. And then you're going to want to attend any additional trainings, including referral marketing, digital marketing, life insurance for national brokerage, senior marketing through American Eagle. These are live trainings that are available on our training calendar on a weekly basis. Also, every Friday we have a live sales forum class available at 11 a.m. Eastern Standard Time. It lasts approximately 60 minutes, and it is a 12-part program that you're going to want to go through and experience all 12 parts of that program. You'll also be able to utilize our on-demand trainings that are available in our back office and also through the various carrier websites. So as you can see, there's a lot of training available to you. I also want you to remember that you are first and foremost a salesperson who just happens to be selling an intangible product called insurance. And for that reason, I think it's really important that you take advantage of any books, any CDs, any seminars that can help you to become a better salesperson. It just so happens that we have 6 of the best all-time sales training programs available for free in our audiobooks area in the back office of the USABG website. Don't miss out on that. The next thing I want to talk about is investing in your business. Professionals need high-quality tools to be successful. You're a professional insurance salesperson. You're going to need professional high-quality tools to be successful. It's just that simple. That starts with your personalized USABG website with embedded links. You're going to need high-speed online access. Don't skimp on your broadband there. Get the fastest speed you can get. And you're going to need an up-to-date computer. I would say if your computer is 5 years old or older than that, it may be time to update that. You're going to need a nationwide unlimited calling plan as well as a toll-free phone number if you want to be successful. We also recommend the iBoomerang Gold package. This is going to include your calendar with your appointment scheduler, your contact management and your autoresponder, your email marketing tools, your text marketing, your shortcut URL, and your web conferencing. You put that all together, and that's an unstoppable package that you're going to need if you want to be successful. Next, you're going to need leads. What we know is that people who shop online are typically going to buy online. So with that said, live call transfers are the hottest thing right now in health insurance leads. And we recommend that you get those. Also, we recommend internet leads, shared or exclusive. Shared internet leads are obviously shared with other agents or call centers. Exclusive leads are not shared, but there's nothing that could have prohibited that person from maybe getting on another website. If you want a truly exclusive lead, try a telemarketing lead. And we have a great resource for that through our leads area. Make sure you use your lead credits that are going to be given to you either through USABG, through AHCP, or Go Health. Also take advantage of the B-Lead program. We write a ton of business off of B-Leads, folks, and you can too. So you'll be provided with some B-Leads to get you started, and then also you can get free B-Leads on a weekly basis, and you can also purchase additional B-Leads. So get as many as you can and work those because they really are good, high quality leads. And don't forget that traditional methods still work. So for example, referrals is really the best type of a lead that you could ever get. We recommend using our dining dough vouchers. That's a $50 dining voucher through restaurant.com to help you to generate referrals. Advertising, we recommend working with your weekly community newspaper. Direct mail works, especially for life insurance and the senior market. This would be for mass mailing or pre-approach letters as well. Networking is a very hot way to write business, and we recommend that you attend our monthly referral marketing training where they'll really teach you how to do that. So if you want to be successful, you need to have a plan, and that is absolutely the case here at USABG. We want you to know that working from home does not equate to being at home. You have to learn how to really, you know, set a difference between the two. One way to do that in order to be successful is to plan your day and stick to it. Set your daily goals. We recommend that you utilize the rule of 80. That means you need to set a goal to make 80 calls per day, and you can give yourself a credit of 10 calls for every presentation that you make. So if you make 5 presentations, then you only have to make 30 calls that day. So it's a great way to manage your time and make sure that you're, doing the footwork that you need to be doing. Make sure that you get outside a couple times a day. Take a break, go take a walk, ride your bike, get outside of your office, and get away from the phone for a while, at least a couple times a day. That'll re-energize you and reinvigorate you. Make sure that you balance your week. 60 to 80 hours of work is too much. 15 to 30 hours is probably too little. So make sure you schedule 40 or so hours of work time every single week, and you'll be fine. Here's a sample work schedule that works for a lot of agents. It's a 44-hour week. On Monday, Wednesday, and Friday, you're working 7 hours, typically 9 to 12 on the phone, 1 to 2 for administrative work. Notice he took some time off for lunch there. 2 to 5 on the phone. Tuesday and Thursday, those are 9-hour days. That's 9 to 12 on the phone, 1 to 2 administrative, 2 to 5 on the phone, and then there's some night hours there, 7 to 9. Saturday, 3 hours, 9 to 12 on the phone, and then Sunday night, 7 to 9. All right, let's talk a little bit about contacting prospects. Just to kind of give you an idea on what it might sound like when you're calling some of your leads. So it might sound something like this. Yeah, hi, my name is Don Duryea. I'm a licensed health insurance specialist with USA Benefits Group. We're one of the top insurance agencies in the nation right now, and we've been in business since 1988. Now, we currently enjoy an A+ rating with the Better Business Bureau. And you were recently on one of our affiliated websites looking for information about health insurance. If you're like most people right now, you're probably a little bit confused. Maybe you're frustrated a little bit about the current health insurance situation in the country today. Well, guess what? Since I'm a health insurance specialist, I can definitely help you navigate your way through this maze that's out there right now, and I can help you find the best plan for your individual situation. Now, as you've probably heard, Obamacare has had a lot of problems, including sky-high premiums, high deductibles, and very narrow provider networks. Also, many of the co-ops and exchanges have gone belly up, and the insurance carriers are losing hundreds of millions of dollars. So it's not a very good situation. What we can do for you is we can help you find an ACA plan or perhaps an alternative private insurance plan that could prove to be maybe more affordable for you and maybe provide you with better coverage in the long run. So what I need to do is I need to ask you some questions so we can determine which plan will be the best fit for you. Now, we really do recommend that you focus on higher income prospects. If a prospect falls below 400% of the federal poverty level, they very well might be eligible for a subsidy from the federal government to help them cover the cost of an ACA plan. Now, there's many problems associated with this niche of the market. First of all, it's a very cumbersome enrollment process, and there are many follow-up issues that you will have to deal with. Second of all, a high percentage of these clients don't pay their initial premiums, or they cancel their plans after several months. Most importantly, most carriers right now are paying very low commissions or no commissions at all to sell these plans. So we recommend that you stay away from this market for right now. We want to focus instead on self-employed individuals, small business owners, and other clients that are above 400% of the federal poverty level. And they are all going to be excellent candidates for an alternative to Obamacare, such as a short-term medical bridge plan. Now, this is simply a short-term medical plan that we refer to as private insurance because it does not involve government exchanges or subsidies. So, what's this all about? What is a short-term medical bridge plan? What is private insurance? And why is this working so effectively right now? Well, a short-term medical plan is really nothing more than a major medical plan that has a termination date, therefore reducing the risk to the carrier. Now, these plans typically have several knockout underwriting questions, and this results in much more affordable premiums for the client. In fact, the typical short-term medical plan is going to be 50 to 75% less than an Obamacare plan, and usually will provide better coverage with lower deductibles, lower out-of-pocket expense, and less PPO restrictions or penalties for going outside of the PPO. Now, this is really important because these lower premiums will allow for the addition of ancillary products such as critical illness and accident plans. And when you add these ancillary products in, this creates what we call a total protection plan. Now, even when you factor in the penalty for not carrying a qualified ACA plan, clients can still save thousands of dollars every single year. And this is because short-term medical plans fall outside of healthcare reform, and they can also offer much higher commissions. So in most cases, short-term medical commissions are 2 to 4 times higher than ACA plans. In fact, you can't even really compare it anymore because most ACA plans right now are paying 0 commissions. Now, what is the risk to your clients when you sell them a short-term medical bridge plan? Well, first of all, if your client is covered under a short-term medical plan and they remain healthy, they can usually requalify for another short-term medical plan the following year. If your client is unfortunate enough to experience a sickness or an accident, well, guess what? The short-term medical plan will pay the claim, and it will pay it very well because it's a major medical plan. Now, if for some reason the client becomes ineligible to requalify for another short-term medical plan because of a change in their health, then they're going to have several options. They can either sign up for an ACA plan during the next open enrollment period, or they can sign up for a guaranteed issue short-term medical plan, which we have several of those, or they can even possibly purchase a defined benefit plan, which are all guaranteed issue products, and we have several of those options. Now you can go you can go out of your way and protect your client by coordinating the effective date of the short-term medical plan with the open enrollment period whenever possible. What about the tax penalty? Well, by now you probably know that under Obamacare there is a tax penalty for anyone who does not have a qualified ACA plan. In 2016, that amount is 2.5% of their adjusted gross income. Now, most clients can save more than enough money to cover any tax penalty by going with a private insurance plan or a short-term medical bridge plan. However, your client can obtain an exemption from the tax penalty by, by enrolling in a healthcare sharing ministry program. You can sell them a program through Altrua Health Share, which is an organization that we are contracted with that pays commissions to agents, or you can refer them to another organization such as Christian Healthcare Ministries, which offers programs for as little as $45 per month for an individual. Okay, using your USABG subsites. Every signature agent is going to receive a branded USABG website. Now, this site is going to allow you to do business in the individual market through the use of embedded links with also PowerPoint presentations and an HTML interactive worksheet. Embedded links are going to allow you or your clients to immediately access your products without having to log in with your user ID and password. That makes it a lot easier for you to sell. Also, your affiliation with USA Benefits Group is gonna build credibility and help you build trust. Don't forget to show them our Better Business Bureau rating. Our A+ rating is going to go a long ways towards helping you build that credibility. Also, don't forget to show them your picture and possibly show them your insurance license, as that will also develop an additional trust factor. Last but not least, always have them join you on a web conference. This really does set you up as an expert and somebody who is on the cutting edge not only of the industry but also on technology. Now, follow-up is essential for long-term success in this business. So after you close the sale, make sure that you send your client a thank you email through the email template tool. Include the name of the plan, the network, the cost with the application fee, the monthly cost thereafter, the cost of the association, and so on. Make sure you attach copies of the application and a brochure if it's available. Include all of your contact information and a link to your website. Then set up a 12-month marketing campaign. You can learn how to do this on the iBoomerang trainings. This 12-month marketing campaign is going to send out a different email every single month telling your client about different products, telling them about our referral program, and so on. So it's drip marketing at its best. Make sure you call your client the day after the sale to solidify the deal. You know, people will get cold feet and start to wonder if maybe they didn't make a mistake. Well, you need to, nip that in the bud simply by calling them and making them feel more comfortable. Also, call them a week after that and ask if they have any questions. This is a great time to use the dining vouchers to get referrals. All of this is going to serve to establishing credibility and building trust. All right, I want to talk about 10 things right now that you can do to be successful. And these 10 things, if you can do these will virtually guarantee your success. So the first one is set your goals and write them down on paper. Number 2, invest $1,000 to $1,500 per month in leads. Number 3, utilize a dialer program like DYL. Number 4, make sure you work 40 plus hours per week. Number 5, make sure you get licensed in multiple states. Don't just work in one state. Number 6, make sure you have the gold package working for you through iBoomerang. Number 7, utilize the USABG training program. Take advantage of all the training that we have to offer because it's all very good and it will all help you get where you want to be. Number 8, make sure you attend the weekly sales call every single week at 11 a.m. Eastern Standard Time. It lasts approximately 60 minutes and it will keep you right on top of what's happening with USABG, with our industry, what's going on with lead vendors, and so on. Number 9, make sure you're selling the total protection plan. Make sure you're adding your critical illness and your accident plan or possibly a gap program along with your health insurance sale. And number 10, we have a brand new program. It's called a level funded small group plan. You can learn more about that. It's a very, very interesting program that can help you to become active in the small group market. Last but not least, you're going to need agent support. So basically, here's how it's going to work. The first thing that you need to do is download, print, and read the agent reference guide. You can find this in the Getting Started area in the back office. Now, your first line of support is always going to be your direct upline manager. If for some reason you can't get a hold of them or they don't have an answer for you, then you can contact their upline manager if they have one. Also, the USABG home office can help you if you have specific questions or problems that your direct upline manager cannot help you with. Also, iBoomerang is available to assist you with any questions or problems related to Web Tools packages or iBoomerang products. And you can email, you can chat, or you can contact them by phone. iBoomerang does host a live support forum every Monday at 1 p.m. Eastern Standard Time to further assist agents. Also, for the most up-to-date carrier contact information, log into the USABG back office, click on the USABG library, click on carrier resources, and then click on carrier contacts. Please download and print this document for quick reference as it will become invaluable to you as you start to write business. All right, folks. Well, I want to thank you for attending New Agent Training Part 3. Your attendance code is on your screen. And please make sure that you put that code in so that you get credit for your training. I want to thank you for attending Part 3. And whenever you're ready, move on to Part 4. And we look forward to your participation and your success here at USA Benefits Group. Thank you very much. And goodbye.